Testing 1.
Testing 2.
Testing 3.
Testing 4.
We got it.
Excellent. Here we go.
Welcome to the Testing Podcast.
Welcome, chaps. How are we?
All good, thank you.
Yeah.
Great to be here.
It's awesome, isn't it? So, welcome everyone to the Testing Podcast. This kind of extra special episode.
It's kind of, isn't it?
Yeah, it's really cool. It's extra special in many ways because we've got 2 fantastic guests. But it's great actually because what we're doing here is blending science and research with a real patient story as well. And actually, you've both been on the podcast already. So, Richard, you've been in the studio, and Jonathan, we did a Testing Stories, didn't we? That would be 2 years ago when we launched the podcast.
Yeah, it would have been, yeah. So welcome to our actual Testing Podcast studio rather than the online Zoom version.
Yeah. Thank you for having me.
Yeah, no, well chuffed. And then it's also extra special because what you can't see is behind the scenes there's a whole load of other people with some other cameras, because this is also all part of a documentary that you guys have been really heavily involved in, isn't it? That hopefully is going to be airing next year, so 2026. And hopefully this will form part of that documentary as well. So it's a very exciting day.
Blimmin' exciting, isn't it?
Very much so. Yeah.
Thanks for taking the time out of your day to come and join us today. And I'm really, really excited about this episode. There's Richard, you left off on a really good tangent from our last podcast episode with you. I was like, I'm just itching to hear more, absolutely fascinating.
Some more funny stories.
Yeah. I think
lots of anecdotes.
I think we missed a few out, didn't we? So we're hoping we'll get back to them today. But and equally, Jonathan, hearing more about your story and how this all ties together, I think it's going to be such a fascinating episode. So stay tuned, guys.
Yeah. So for those that haven't heard those previous episodes, perhaps a little bit of intro from you guys in terms of who you are and what you kind of do. So kick off with you, Richard.
Okay, so my name's Richard Lea. I'm a professor of reproductive biology. I work in a vet school at the University of Nottingham, and I've been interested in male fertility, challenges to male fertility in humans, but also in other species as well. And a big emphasis of my work is looking at pollutants in the environment and what role they might play in declining male fertility. After all, we all inhabit the same world, all the species. So my thoughts are what's happening in some humans, we'd also see in other species. And in the last episode, I discussed the dog, the household dog, and in fact, semen quality is declining in that species. And that's covered at length, I think, in the previous episode. So that's really me. That's my interests. Yeah.
So kind of almost like for you, say I'm in vet. You're in a vet medicine sort of school, university. Yeah. It seems a bit weird to be talking about vets and animals and humans. It kind of almost sounds like, well, hang on a minute. You're dealing with animals. What's that got to do with male fertility? But you're seeing really there is a huge crossover.
Oh yes, absolutely. I haven't always worked in the vet school. I've been there for many years, nearly 20 years now. But prior to that, I worked in various research units that were more medical orientated. And over that period of time, you get to understand that actually what's happening to humans is very similar to what's happening to at least some species. So as you say, Ian, there is significant crossover in these things. So declining semen quality is one of those things that we see in other species, particularly the dog. There's some evidence in the horse now as well, looking at records. Cryptorchidism is another thing that we see across the species.
Hang on, let's demystify that word. That's a big word.
Yeah, sorry.
I was a bit like, what's that one?
Yeah. The giveaway is the crypt, isn't it? A crypt is like a hidden
cryptocurrency, maybe.
Cryptocurrency, hidden currency and hidden testicles.
That's exactly what it is. Yeah. It's where the testes don't descend as they should do. Because in most mammals, not all mammals, but in most mammals, the testes start in an abdominal region, and through a mechanism, which I can talk about, they descend into the scrotum, and it normally happens sort of just prior to around birth, a few days afterwards, depending on the species. And sometimes it goes wrong. It doesn't happen appropriately, and one testis may descend only, and the other one is stuck, if you will, in a higher position. And the problem with that is that if a testis doesn't descend, it's kept at a much warmer temperature than it normally would. And in order for sperm to be produced by testes, the testes have to be kept just a few degrees cooler than body temperature. So that's it's a problem that we do see increasing. So there's an increased incidence of cryptorchidism in human male babies in various countries now. And what I find fascinating is where you see an increased incidence of cryptorchidism. Quite often, you also see a decline in semen quality, and you also see an increased incidence of testicular cancer. So it's almost as if these observations are linked. And indeed, there's a lot of evidence that these observations are linked, and they have a similar trigger. So when the testes are descending, the cells within the testis have to develop appropriately with a good balance of hormones and factors to control that process. And if there are environmental factors around that interfere with the normal development, and I include descent of the testes as part of that, then things can go wrong later in life. And when I say going wrong, I mean there's reduced fertility would be the one that we talk about a lot. But maybe I'm getting ahead of myself here. I'm straight into it here. So.
No, it's good.
Yeah.
Diving straight in. But I want to bring Jonathan in to welcome you and kind of hear a little bit of your story. And I think we'll get into your story in a bit more depth as well as we get going. But yeah, Jonathan, it'd be great to hear about you because you've been such a great patient advocate over the years. I mean, we've known each other for years now, haven't we? You've done so much work back in the day with FNUK when we were doing the support group and yeah, I think you've just been a real champion for male fertility, which is awesome. So, but yeah, a little bit about you would be awesome to hear.
Thank you. Thank you for having me first and foremost. Yes, I'm Jonathan Luwagga and I'm a patient advocate for the Fertility Alliance actually. So I kind of work closely with them and the guys at Nixies and Fertility. Spreading awareness as a patient advocate. I work for Transport for London actually, and I do some, 1 hour workshops, awareness workshops around fertility actually, and talk about my journey and just to inspire other men to kind of be open and honest about their journey. It may not be directly linked to fertility, but actually just men's health just in general. So it kind of helps other men, to be aware of, of what's going on with their bodies.
Yeah, that's awesome work what you're doing. You two are not allowed to geek out over trains.
I was about to say, what do you do at Transport for London?
We've already had a near-on photography podcast. We're not having a train podcast.
I'm a man of fads, it's how it is. What do you do? I'm going to ask it.
I'm a contracts and business officer.
Oh, okay.
So I'm back office stuff.
See, nothing to do with
It's
trains.
too important though. It's one big team effort. Trains don't roll in and out of London without guys like you. So
Right, let's get that out of the way. That's done. Right, trains are done. We're not going there again.
There's the icebreaker anyway.
Yeah, absolutely. No, Jonathan, thank you so much. And I think we'll get into your story in a little bit more detail. So, we've got to explore kind of the impact this has on men and everything that you're doing to kind of spread that word and kind of make sure that men are aware of their fertility. But I think let's go back to you, Richard, in terms of, you've already mentioned declining sperm quality and it's had quite a lot of media coverage, hasn't it? Spermageddon has been the big thing. I know Shana Swan is involved in the documentary that we're filming for today. And her book on Countdown, was it called Countdown, wasn't it?
Countdown.
Yeah. Which is a brilliant book. But again, there's been some controversy around that, I know. And so there's these different kind of views, isn't there? Okay, are sperm counts really declining or are they not? Or are we getting better at assessing sperm and therefore, all of this, that and the other? What is the narrative out there around this decline?
Oh, it's a huge debate, Ian. So the concept of declining sperm counts has been around for a long time. So we're looking at declines over 50 years, 70 years even. And there's been many, many studies in the human, which we call meta-analyses. So that's where sperm count data has been collected from clinics, different clinics at different times in different places. And of course, because of that, those clinics may do things a little bit differently. So the quality assurance levels have changed over the years, for example. Modifications in the way tests are carried out, different staff doing the tests. And that's fine, providing that all this data is analysed appropriately. And that's where the complicated statistical analyses come in. So you can put in all the potential confounders, and also the population of men coming in as well. You know, are there men with known fertility problems? Are they unselected, which means just general volunteers coming? How do you account for all those confounders? And it's really quite complicated. But the upshot of it is that the most detailed meta-analysis that has ever been carried out, in my opinion, is the one by Shana Swan and her team. And she took into account as many confounders as you possibly can, and looked at decline in sperm counts over the years, and showed that, yes, sperm counts are continuing to decline. And what's particularly worrying about Shana's team's data is that after the year 2000, the rate of decline actually doubled.
Wow. Wow.
And that's a really, really big concern. Now, of course, there is a camp that says, well, hang on a minute, is this really, really happening? And this is a little plug for my own work here, because I've done some work, as I've discussed in the previous episode, on dogs. So these are not experimental dogs; they're healthy dogs that are used for breeding, and they're used for breeding to generate dogs to support partially sighted people. So they're very fit, they're well looked after, and they come in for a regular MOT, if you like, and as part of that checkup, they have a sperm sample taken, and it's relatively straightforward to do that with the dogs. And that's been going on for years and years and years. And so a number of years ago, I found myself in a position where I could analyse that data with my colleagues at the vet school. I should mention our dean, Professor Gary England, who has a contact with this setup of dogs, and he's been extremely supportive in this process. So we analysed this data, and we found that over a period of 26 years, there was a decline in sperm quality in household dogs. The quality measure, interestingly, wasn't counts, but was motility of the sperm, which is interesting in itself. But there was a clear decline. And what's important about that original study, it was published back in 2016. We've updated it since then, actually, but that's the main publication. What's important about it is that all the data has come from one single laboratory.
Right.
And for that paper, there were 3 technical staff involved in doing the experiments, analysing the semen using routine techniques. So if you compare that scenario to the human data, where you have different staff in different locations at different times, and you pool all the data, you can see straight away that you remove some of the confounders that's implicit in the human studies. This no way denigrates the quality of the human work. You can only do as much as you can do. So the way I like to think of it is the dog work showing this decline in human sperm quality parallels, it mirrors what we see in the human.
Fascinating.
And has that been done in any other species over that same sort of, in that same kind of way that you've kind of collected that data from dogs?
Not to the same extent. There are a couple of studies that have looked at semen quality in horses. So one of my colleagues at the vet school, Rebecca Blanchard, did an analysis on that, and there's evidence that motility actually in that species has declined over a period of time. I can't remember the span of time now. I need to go back and look at her paper. But the most robust study outside humans is our study, as far as I'm aware, anyway, on the dogs.
It's fascinating, isn't it? And that rate of decline of the actual quality there is. You mentioned obviously it parallels, but is the data showing that? You mentioned, was it the year 2000 that it doubled? Is that very much the same sort of scenario as it is in the dogs as well? Is it kind of a similar sort of trace of decline?
That's a really good question. So we haven't seen that doubling since the year 2000. It is a different parameter that we see.
Sure.
So a lot of people say to me, yes, but all the data in the human is sperm counts, and that's true. There are some studies that are looking at motility as well, but the 3 prime things that you look at in sperm is how many are there, you count them, how well do they swim, how motile are they, and if there are any signs of abnormalities, and of course you could add on to that DNA fragmentation and other tests as well.
I was going to say, because obviously with the latest technology of the fact we can do DNA frag testing now, that would be lovely to have all of that retrospective data, because that for me is like the kind of key to life in some ways. The DNA is the ingredients, isn't it? So
absolutely,
it'd be interesting if we're not going to get that, but if we could have seen that from that same sort of period, that would be quite a fascinating thing to learn.
Yeah, I've had exactly that same thought, Toby.
I bet you have.
Yeah, so
we're not the first one.
We're trying to find a way to look into that. But yeah, that would be fantastic, because that's the circuit board, isn't it, of the sperm that determines how well they are, how they function, how they swim, and all those things.
Yeah, because obviously linking back to our patients, quite often patients get told, "Oh, we only need one sperm in ICSI, etc." And yes, of course, that's true in respect of you need one sperm for the egg, but obviously this study's measuring kind of the bigger picture of numbers. But yeah, the DNA side of it is really key to the life, isn't it? So
absolutely crucial.
Maybe moving forward, that's how we can kind of work together on that. For future studies. Yeah,
it's in my head for sure. We're trying to investigate that one.
Yeah.
How big was that meta-analysis that Shana Swan did? How many patients was that looking at? Do you know?
Oh my goodness! It was there would be thousands of patients involved. Her last paper involved patients that were worldwide, because previous studies had focused on more industrialized areas of the world. And there were certain regions of the world that were left out, and it was just getting access to the data. So Africa, Asia, South America, I think as well. She managed to get data from all these additional regions of the world, and still showed that regardless of where you are, there's still a decline in sperm quality. And I think that really was the trigger for her book Countdown that you mentioned earlier, which is a very readable publication. Actually, I've read it myself. It's it's good.
Do you think so? There are, it's still a contentious issue, isn't it? And there's still some debate. But do you think people are waking up to this a bit more now and saying, actually, this is real? We need to pay attention to this.
I get the impression that they are now, and the only way that can happen or increase. Let me get my words right here. Yes, it is happening, but it's all about awareness. It's about doing podcasts like we are doing right now, talking to people like yourself, Jonathan, and you have your own story to tell. That does raise awareness, and we've had numerous conversations on the side just preparing for this podcast and meeting yesterday evening as well. It's the people we talk to. What do you do, Richard? Oh, well, I work on fertility and factors that may control fertility. What's that about? And all of a sudden, you've pulled people in.
Yeah, because it's a fascinating topic to talk about, for sure.
Yeah, it is. Yeah. And people do listen, and I enjoy talking about it, to be honest. I can tell that you like telling your story, Jonathan, from what I've heard. And, and this is the way you do raise awareness. So the more we hear about this problem, the better.
Absolutely.
Yeah.
What happened in 2000? That's the question.
Yeah, that's the question mark, yeah.
Oh, that's a tricky one. Yeah, I don't know.
It was supposed to be the cyberbug, wasn't it? In 2000,
Oh,
was
God,
that?
yeah.
Remember that threat that kicks around the cyberbug?
How old were you in
build up to that,
2000?
wasn't it?
Huh?
How old were you in 2000?
I was 10 years old.
When your Game Boy might stop working.
I remember that on the news. I remember the
Yeah, it was a
cyberbug
huge
being a thing. But I was a bit too young to understand about sperm at that prime age.
Absolutely.
But of course, all of this is very much data, and obviously it's really fascinating to understand the data. But obviously, Jonathan and I have had our own fertility journeys, and in amongst all that data, is real people's lives, and it is very much life changing depending on the outcome of that data. So I think actually it's a really good point now to bring Jonathan in and understand your story, to kind of it'd be good to hear from day one with you. It'd be nice to hear everything.
Oh, okay, yeah, sure. I kind of, my journey started unknowingly started at the age of, I think, 13 or 14, when I had undescending testicles. But obviously I didn't kind of realize how much of an impact it would have on me until I got into a relationship back in 2020. And then me and my ex-partner, unfortunately, we were trying to have a baby and it just didn't work for us. And, me being naive, I kind of pushed for her to kind of get herself checked, which was a little bit selfish of me, but I didn't have no real understanding that it could affect me.
Sure.
I kind of thought it would affect her. But then, she went for her test and everything was fine. And then the attention then turned to myself. And then it was kind of like, having to call the doctor and, go and speak to him. But I kind of took a lot of time to kind of making that call to speak to him, because I was kind of quite apprehensive about going to do tests. But then I kind of had to do it, and I'd done it. And it was just kind of like an awkward meeting in a doctor's surgery, and it was just kind of like having to kind of do like an invasive examination of myself. I actually first looked at my records to see how to understand his testicles, and he wanted to see if there's been any changes. No changes, and then he kind of just pushed me to urology, and I went to see a urologist, and then I went through a number of tests to kind of get to the fact that I had non-obstructive hemospermia. That's kind of how I kind of dived into.
I'm kind of curious though. So obviously 13, you said that was diagnosed with undescended testes. What was what led you to the point of get that diagnosis? Because at that age, these kind of things are really embarrassing. They're embarrassing enough for us as adults, let alone obviously a teenager. So where how did that kind of come about when you?
So that I was playing football actually in the playground, and the ball kind of hit me in the groin area. And then I kind of fell onto the floor, and I was in a lot of pain, and I didn't quite get the pain. I didn't quite get it while I was in so much pain. When I went to the hospital with my family, and then that's when they kind of looked and said, "Where are your testicles?" And I'm like, I don't know.
Where are your testicles?
Yes, yeah. Wow. I don't know. And then they kind of, saw that my testicles were in my groin area. And then that's when they had to, do an operation a few weeks later to kind of put them into the scrotum.
Okay. Had surgery from that?
Yeah, I had surgery from that. And I was off, I remember being off school for about 2-3 weeks, and everyone was like wondering where I was. And when I came back,
that's not one to discuss, is it? With your mates.
Yeah. And because I'm a twin as well, it's kind of made it like.
Oh, I didn't know that.
Yeah, I'm a twin.
Oh, okay.
So it made it a bit awkward.
Did your twin have any similar issues?
No, not one bit. And
assuming that your twin is a
boy.
Boy.
Brother. Yeah, my twin brother. Yeah, so he no real sperm issues with him. So it's kind of. Yeah, just interesting the fact that I've
and did you tell any of your friends, your twin, your family? Like obviously your family knew, but like was you quite open with friendship groups when you went back to school? Everyone was like, "Where you been?" What was?
I just said that I had like operation in my groin area
and just left it at that.
And just left it at that.
Yeah. Because like I say, it's an embarrassing thing, right? I mean, like to talk about your balls and teenage years, like
of course,
just like
God,
skip
can
over
you imagine
that topic,
going in at school? It's like at 14, 13 points. Oh yeah, I've just had my testicles put down back in my nutsack. It's like you're just gonna get the piss ripped out of you, aren't you?
Of course.
But it shouldn't be the case, and I think that's why these sort of podcasts, and hopefully the younger generation eventually will listen to this. They're going to grow up one day, but that's that kind of support early on among friendship should actually just be like, mate, are you all right? And you should be able to go, oh man, I had this issue with my balls. And
can you remember being a 13, 14-year-old boy?
Yeah, I mean, I was bullied for being ginger pubes. So exactly. But that's the thing, right? Is that we have these kind of jovial comments, and even as you grow up as an adult, you kind of like banter is a thing, isn't it? But this is a serious thing, right? And it's obviously shaped your life from there on out. So
absolutely, and obviously it's kind of made things different. I said different and difficult at times, but the most interesting fact is that my parents didn't quite know. They don't actually remember when I spoke to them about it now. They don't actually remember what they were told by the surgeon or by the pediatrician at the time or whoever. They don't remember anything, and they didn't remember how much it could affect me as well. So when I went to that doctor's appointment, I spoke to him. I said, I had undescended testicles. Oh no, it's okay. Don't worry, it'll be fine. Like you can still have you can still get sperm. It's okay. Don't worry, you'll be fine.
Yeah, just
I'm like,
flippant. Yeah.
okay.
Was that your GP or
Yeah, my
the
GP.
urologist? Yeah.
Yeah, and then, you know, and it was even at the end, it was like, oh, good luck. I'm like, can you imagine just
Wow.
telling me good luck?
Yeah,
I'm
yeah.
like, well, okay, yeah, I need a good luck, but I'm like, God, the way you just said it's like, well, whatever happens to you happens to you.
Yeah, like
you know?
good luck. Yeah, yeah,
Yeah.
That's not.
But then obviously going to see urology kind of did help me to have a real understanding, because, you know, having to do like a ultrasound on your testicles, so I've got to see like the size of my testicles and the effect that growing up all these years later, how small they actually are. Actually, they're 3 times smaller than average male, and also the little white dots on the testicles could have been caused by bacteria.
Right.
So it's like, in understanding environmentally, could things have been different if I'd been in a...
Yeah. How, sorry, I had to sort of partly interrupt there, but how has it been, because obviously you've been really heavily involved in this documentary, and we still need to get into all the science and stuff, but how has it been for you working with Richard and the producers of this documentary and learning about the endocrine disrupting chemicals, and that may have played a role in your fertility?
Well, interestingly enough, this is the first time I'm actually going to speak to Richard about it, actually.
Yeah, you guys haven't actually met, although you're in the same documentary.
So I'm actually interested to know more about it myself, but I haven't spoken to the producer and kind of given me a bit more information.
So you're still learning then?
Yes,
really?
yeah, still learning.
Which is crazy, because how long ago was it that you got that diagnosis of non-obstructive azoospermia? It's quite a few years ago, isn't it?
Yeah, 2022,
Okay, so 3 years.
23.
Yeah.
It's 22 or 23, one of them.
Yeah, it's
Yeah.
like 2 or 3 years ago.
Yeah.
Because I remember when we did the testing stories, I think you were still kind of going through it, and you were
Absolutely.
still not really that clear on what was going on for you.
Yes, definitely.
Yeah. So there's still a lot of learning still going on for you now, even after all these years.
Oh, absolutely. And also I feel like as if the more learning for me is more for the fact that once I begin to actually, when I get a new partner, and when I go to do IVF, understanding that element of, you know, fertility world in IVF, and then what can I do to support my partner
Sure.
environmentally to help her.
Yeah, to make sure she's aware of.
Yeah.
Yeah, absolutely. So I think at this point we need to go back to the science and understand kind of what's going on. I think the first question is, what is causing, or what do we think is causing this decline in sperm quality?
That's a really big question and a very important question. So we've mentioned these chemicals in the environment, and these chemicals come from plastics, industrial sources, pesticides. There's a whole range of chemicals from different sources, flame retardants, for example. They are there. We're exposed to them all the time. And so there is a school of thought, and I back that school of thought, which says, well, because we live in this polluted world and we're exposed to these chemicals, they have a role to play, because that's what's changed over the years. As sperm count declines, the level of pollution has increased. You know, it's something like 140,000 new chemicals over the last 10 years or so have gone into the environment, if you want to quantify it. So some of these chemicals can interfere with hormone function, and that's where the term endocrine disruptors comes from. So endocrine means hormonal. That means that they can behave like the male androgens, or inhibit the male androgens. So androgens means testosterone, the hormones that us males rely on for fertility and reproductive development. Or they can interfere with estrogens as well. And both estrogens and androgens are important in males and females. We tend to equate the androgens with the male and the estrogens with the female, of course. So there's been a number of studies that indicate that is the case. Lots of studies, sort of animal-based studies. There's a number of epidemiological type studies where chemical contaminants have been measured in blood over a period of time, or in semen. And so these measurements are associated in some studies with declining sperm quality, or they might be associated with testicular cancer. I mean, there's a huge number of these.
Sorry, can I just stop you there?
Yeah.
Because it's that word association, I think, is quite interesting here, isn't
Yeah.
it? Because it is an association, not a cause. Is that right? Or cause?
That's exactly right. And that's why we need to be a little bit cautious in discussing this area. It's all about the weight of evidence that suggests there is an environmental effect. And one type of contaminant that sometimes is less mentioned are the contaminants we purposely expose ourselves to. So I'm talking about medications, analgesics, painkillers, paracetamol, for example, the contraceptive pill. So these we take willingly.
Antibiotics.
Antibiotics, indeed. And they will go into the environment as well. But then you might ask, what about during pregnancy? Are pregnant women taking painkillers? So the answer to that is yes, with support from GPs. So as far as I'm aware, paracetamol, for example, is still okay from a GP perspective, but there is some data that suggests you need to be a little bit cautious taking paracetamol, because that can interfere with hormonal action if taken at a specific stage of pregnancy. Now, this is just some data. I'm not saying that everyone should stop taking paracetamol at all here. All I can talk to you about is the data that I've looked at, the papers that I've read. For me, I think that the problem we're experiencing as a population is a combination of the two. Mm-hmm. For sure, there are lots of plasticizers out there, lots of flame retardants. We're exposed to flame retardants in this very room now, and the carpet that we're standing on, sitting on, and all around us. So they're there, and there are lots of studies that suggest that they have a biological effect, and that biological effect can be at the hormonal level. So for me, it's a combination of the two. The environment is changing. Plasticizers, pesticides are involved. I think there is a strong case for the medications that we take as well that may contribute to that. But showing cause and effect, Ian, as you alluded to it earlier, is very, very difficult. We can take sperm and put the sperm in a plastic dish and add a chemical to it and show that chemical has an effect. And I've done that. I've done that with dog sperm, I've done that with human sperm, and we've looked at a plasticizer, a type of a phthalate, for example, and sperm motility is reduced. And then I often get the question, yes, but how much are you adding? Is it really environmentally relevant? Well, I think it is, because the other thing that we've managed to do with our dog studies is that unfortunately a lot of male dogs lose their testicles, not for the purposes of my research, just because this is a standard veterinary practice for behavioural reasons, to stop breeding and those type of things. So these testes are removed, and I managed to get permission from the vet clinics to have a look at them. And see if there are any chemicals inside them.
Fascinating.
Yeah.
Wow.
So it's an amazing resource of tissue. They're there. Either I look at chemicals in them or they're chucked away. So I may as well do something with them.
Sure.
And so that's exactly what we did. And we detected quite a range of chemicals in these testes. It's a little bit more difficult to do it in the human, of course, for obvious reasons. But the thing is, these dogs live in our houses, they share our environment, they're exposed to exactly the same contaminants that we are.
Yeah.
So
Their
I
food's
see them.
wrapped in plastic.
Yeah,
There's
ultra
many
processed.
similarities,
Yeah,
isn't
yeah.
there?
Yeah, you've got it. Absolutely. So it's a really, really useful tissue resource. So we can measure the concentrations of these chemicals in the testes, and then take that concentration and put a chemical into a culture with some sperm at that concentration.
Okay.
Oh, right. Wow.
And it still has an effect. It still increases DNA fragmentation. We've shown that, and it decreases motility.
And sorry, just to rewind that. Sorry, so that's using the same. So in that dish in that environment that you're creating, you're basically polluting that dish with the same level of chemicals that is found in the testicle. So the kind of environment is quote unquote the same in that respect from its exposure.
In relation to that chemical, yes.
Yeah.
But again, we have to be cautious because in the real world, sperm is not exposed just to one single chemical.
Correct. Yeah.
So we've done it with two chemicals combined and show that they interact. But of course, we're exposed to lots and lots of different chemicals, and those chemicals interact. And there lies the big challenge of this whole field. How do you get to grips with this impact of a cocktail, a mixture of chemicals on fertility?
And say which ones are safe, which ones are not safe, what dose are they safe at? What's the
Absolutely.
cumulative effect of these things over 3, 4, 5 decades?
And generations as well, right? So does this have an impact on, for example, if there's an offspring, let's call it an offspring from that particular sample, and then the next generation, is there then more chance of that having a profound effect? Like, does the long-term exposure over different generations cause more of a problem?
Well, that's a great question, and there's a lot of evidence that is the case. So the initial exposure of if you go back to a developing male human baby, would be via the mother. So the mother has her own chemical exposures, and those chemicals, some of them can cross the placenta, and they can impact on the development. And there's a specific stage of testis development where androgens, the male hormones, are really, really important. And if during that period the chemicals are around and they interfere with that impact of the androgen, the testosterone, then that can impact on the later functionality of that testis.
Wow.
So that baby will be born and may exhibit issues in fertility, but in later life, assuming that there's another generation beyond that, there is the possibility that there's a type of a carryover effect, if you like, of that initial maternal exposure. And then if we go beyond that, then we get into this complex area that we call epigenetics. And epigenetics means that the way genes are turned on and off is altered by a chemical, and that is maintained across generations. So there's no change in the sequence of DNA. It's the signals that switch on and switch off.
Yeah.
So DNA methylation is the one that most people know about on that, and that's where most of the publications are.
Wow. I wonder, just what you said, that 2000 tipping point, is that where that kind of cumulative generational thing is perhaps showing up? So if you're saying that it gets passed on by generations, so what we're talking 4 or 5 decades, aren't we, that this has been going on, that we've seen that decline. So that puts it, 70s? By 2000, that's people that are in their 30s that are now reproducing, but they've got the problem from the 70s. That's where maybe that's escalated it, is because we're starting to now see it in multiple generations.
Yeah. And sorry to add into this as well, and also could it be that the kind of the law of odds of, you know, a male and a female that have both had that exposure then make a baby, that then is a kind of compounded effect, versus perhaps generations before it might have only just been the one. Because obviously we know that if there's a really healthy, good DNA integrity egg, and there is a little bit of DNA frag in the sperm, obviously the egg can do a lot of that repair work, right? So it could, I don't know. I mean, it's just
you're increasing the odds of this.
Yeah.
And is it a case that there's also been research now and studies that have shown these chemicals and plastics have been found in umbilical cords and placentas? You see that in the news and on social media, but is there actual data and research to confirm that?
Yes, we hear a lot about microplastics, don't we? And microplastics being detected in placental tissue, in fetal tissue as well when that's available. And if the microplastics are there, what I work on are the chemicals that leach out of those plastics, the phthalates in particular, BPA, bisphenol A would be another example. So they must be there. Some people have actually measured chemicals. I can't think of a publication off the top of my head recently on that, but I'm pretty sure that they have been detected within placental tissue and fetal tissue.
That's so scary.
It's kind of scary.
It's really scary.
Yeah.
And just going back to that, the development of the fetus. Now, I could make an absolute tit of myself here, so I'm going to try and get
Won't be
this
the
right.
first time, mate. Don't worry.
Thank you very much. But my understanding is, as a fetus develops, in those first few weeks, every fetus is programmed to be a female. And then when the androgens kick in, that changes that fetus to male. Is that right or not right? He's looking at me as if, what the hell are you talking about? He's a reproductive endocrinologist. But it's that turning on of the androgens, or it's
like
the presence of those androgens that triggers male development. Is that right or wrong? Please save me from...
It's partly right.
Okay, I'll accept that because I was right out on a limb there. I'll go with that.
It's a really good and targeted question. That
he's so kind. It was a good attempt, Ian. Well done.
Yeah. So the dogma or the paradigm, if you like, used to be that we're all programmed to develop down the female route, but you have to work harder to become male. That's not quite the case. So recent data suggests that there are genes that drive the developing gonad down the male route or the female route. It's quite a complex area, and it's something that we teach actually each year at the vet school. So that there are germ cells that originate from the hindgut of the developing early fetus. We've got a little bit of embryology here, and they move and they lodge into what we call the undifferentiated gonad. They actually migrate. And some of those germ cells, if it's a male, if it's a genetic male, the germ cells will be XY because of that. If it's a genetic female, they'll be XX, and they'll lodge in that undifferentiated gonad. And through a signaling system between those germ cells and the tissue around, that gonad then either develops into a testis or an ovary. Sometimes it can go a little bit off course, and it's quite rare, and you can have XY germ cells, and there's a bit of ovary development, if you like, occurring because of an imbalance of some sort. But by and large, that's the way it works.
Okay.
So it's that's why you were half right, because it's
but
it's
the
very
reason
complicated.
the reason I asked that question though was then to understand the role of these endocrine disrupting chemicals in that process.
Yeah.
Because is it a case that those chemicals, because again, am I right in saying that those chemicals mimic estrogen, so they confuse that hormonal balance within that process, that the body thinks there is more estrogen than there is? Is that part of what's going on?
That is part of what's going on. In order for controlled development of the testes or the ovaries, you have to have a good balance of hormones, and there are specific stages of development where the impact of the male hormones on the testis are really crucial in order to drive it in the right direction. And if chemicals are around that have an ability to block the action of the driver, if you like, the androgenic, the testosterone driver of that testis, then the testis won't develop appropriately. And this is why we think that a lot of the problems that we've discussed already, declining sperm counts, the lack of descent of the testes into the scrotum. There is another condition called hypospadias, which is where the urethra doesn't develop properly in the penis, and it opens midway along the penis or at the base of the penis. all of these things rely on an orchestration of hormonal cues prior to birth. And if something gets in there and gets in the way and interferes with those hormonal cues, then after birth, then we can begin to see the impact of that interference. So that's where the endocrine disruption, just focusing on the male side, because that's what we're all about today, that's where that can occur.
That's what I wanted to get to, because that actually then brings it back to you, Jonathan, because you had undescended testicles. I can never get the word right. Hyperspadia? Is it?
Hyperspadias.
Is that a diagnosis that you've had as well?
No.
Okay, I've got that wrong as well. How many things? But the undescended testicles could be potentially related to this. Is that news to you?
It's news to me.
Wow. Okay.
It could be.
Could be.
So it's cause and effect. So the descent of the testes does rely on that male signal, what I call the androgen signal, and there are genes switched on which enable the testis and its attached ligaments to work together in a way that pulls the testis down into the base of the scrotum.
And do these chemicals and everything that we're talking about, does this impact men more than it impacts women? Or do we not understand the science enough yet?
Another great question. We know more about the impact of these chemicals on men, but it doesn't mean it's not as impactful a problem for women. And in fact, there's a huge amount of data out there. I used to say we know more about the impact on men and women a few years ago, but it's evening up now in terms of all the work that's been carried out. So if you think of the female baby, in the human, that baby will be born with a set number of eggs, and that determines the fertile trajectory of that individual post-birth. If there are factors happening prior to birth that interfere with the development of those eggs or the quality of those eggs, then that can be really quite impactful later in life. And there's a lot of evidence now that suggests that that is happening. There's some data that indicates that the age of menopause might be changing, the age of puberty might be changing, and all those factors. So when you ask me, is it more impactful in men than it is in women? I would say it's probably equally impactful. You could even argue that it might be even more impactful. So a lot of people will say to me, yes, but you see these decline in sperm counts, but at the end of the day, you only need one sperm. But if you reduce the number of eggs in the female, then is that female not going to struggle with her fertility? And that's a valid point. So it's a problem for reproduction in both sexes, I think is the best way to leave that one.
Yeah, absolutely. Yeah. It's absolutely mind-boggling.
Yeah.
But what's it like for you guys to kind of hear this, that have been through fertility challenges? Like, does this give any kind of reassurance in the sense of, oh, it wasn't me, or there's elements of this that's out of my control?
Well, I think I always say on this podcast I'm the idiot, and I always try.
Well, I think I'm doing a good job of that today.
But I always try and put things in as much layman's terms as I possibly can. But I remember when certainly when I was going through my fertility journey, I remember reading a book, and I can't remember the name of the book now, but there was topics in this book around kind of like environmental issues, and I remember reading about BPA and phthalates and the impact that can have on one's health generally, but this was obviously specific to fertility. And since I've spoke to you now for a number of years, and I find it all quite scary, if I'm honest. It's quite a scary thing that this is actually just something that we're kind of it's in our environment. How can we really escape it when it's everywhere? But I made many sort of lifestyle switches in my personal life when I found these things out, such as getting rid of plastic bottles. I got rid of Teflon frying pan, so I only use like stainless steel now, a high grade. I'm always conscious of any like kind of lead content if there's a metal container, and I've just become more aware of it. And I hope that's a good thing for my future health. But I made these switches a very long time ago, before I had my embolization and my fertility diagnosis. And so I hoped that by reducing some of these things that we're talking about here, these environmental kind of pollutants, I hope that would have had a positive effect on the DNA of my sperm and then obviously into my offsprings. But nonetheless, it still scares the shit out of me, if I'm honest. It's a really scary topic, isn't it? I mean, how about you, Jonathan?
Yeah, same. It's also, like I said, it's like you think, oh, there's another risk involved now. You know, instead of thinking, yeah, there's the element of, okay, this is great. You know, it wasn't just me. Like, it was this, you know, environment's kind of played a factor in it. Well, could have played a factor in it. And, you know.
Because there's a lot of self-blame for men, isn't there?
Yeah, absolutely.
For sure.
Yeah.
Absolutely.
And this, you know, not many men would stumble across this information unless they're listening to our podcast and reading loads of blogs and whatever. So, not that it lets you off the hook or you know, but it, you know, a lot of men are just like, well, it must be me, I'm a failure. It's all my fault.
Yeah, of course, because you know when you're going through it, I don't know about Toby, but when you're going through a fertility journey, you kind of sit back and think, oh, what could I have done?
Yeah.
To make things better for myself.
Yeah.
And then, you know, you're hearing these sort of things, and then you know you've got, you know, radiologists and consultants telling you certain things that, you know, even if you you know, had a number of sperm wouldn't have worked for you because of X, Y, and Z. I'm like, okay, so then I'm not to blame then. I mean, yeah, it eases the stress, but it also adds a bit more pressure on yourself, for me as well. Like, okay, so I'm not to blame, not essentially not to blame, but what else could I still do?
Correct.
Could I still do?
Yeah.
Regardless, you know, like you say, you've done lifestyle changes. Even for myself, you know, I made some lifestyle changes as well, just to, you know, had a developed thyroid problem. So I was on medication that was kind of reducing my thyroid. So it was kind of like, okay, I'm taking all these medications. I'm on taking antidepressants because I'm depressed. You can say paracetamol because I'm getting pains and aches and stuff. And you're thinking, okay, so if I'm, you know, someone saying you've got to do holistically, you know, don't take all the medication, just take these vitamins, or, you know, have these herbs, this will help you. And, you know, culturally, even for myself, you know, I'm an African guy, so, you know, if you go to Africa and have these sort of fruits and go and stay in the sunlight, vitamin D, you'll be fine, you know, all this sort of stuff. So it's very conflicting information for me, and it kind of, you know, but hearing all this sort of stuff kind of definitely generally does help. But also I wanted to ask you a question, Richard, in terms of the fact that, okay, being from Africa and from Uganda, is there like environmental factors that differentiate between Europe and Africa?
Yeah, good point.
Great question.
That's a really good question. For sure that there will be. I can't tell you specifically what they are, of course. I'd need to look into it. But it depends on different practices in the countries. So I dare say that in Uganda there'll be pesticides used on the fields. So there's a huge amount of information that indicate that exposure to pesticides. I mean, one that everyone talks about is DDT. That's not used widely now, but there'll be other pesticides as well that can have endocrine disrupting effects. So it could be. And I say could be because I'm just thinking it through. It's a great question.
Of course.
It could be occupational.
Yeah.
So those people who have an agricultural type job may be more exposed to those contaminants.
Yeah.
But the contaminants are everywhere. And we found in our dog studies, we did an interesting comparative profiling of chemicals in testes from dogs, where we took testes from dogs in the UK from 2 countries in Scandinavia. I know it's not Africa, but they're different countries, Finland and Denmark. And we found that the profile of chemicals was different.
Okay.
So that indicates that wherever you are in the world, you're exposed, but you're exposed to different factors, and it really makes the whole field very, very complicated because it's still a cocktail. It's still a mixture.
Sorry to butt in, but on that note, actually, of the different chemical profiles, then did you see different results based on those profiles? Was there a mark thing that you could note from that?
We couldn't. That's another really good, again, great questions at this podcast. So,
putting you through the mill here, aren't we?
Brilliant. So that was just comparing the profiles. We can't match that, we couldn't match that up with functionality,
of course,
in that study.
Yeah.
And it gets back to the cause and effect. Yeah, we see a difference here, we see a difference there. What does it actually mean? And the reason we collected those testes from Scandinavia, just bringing it back to the human, is historically, a number of years ago now, there was a comparison on male fertility from focusing on men from Finland and Denmark, and there was a difference. So Finland is more of a rural country, lakes and forests and things, and Denmark is more industrial. And the quality of the sperm in these published studies indicated that men from Finland had better quality sperm than those in Denmark. And there was a huge debate about this, and it sort of reflects, in my mind anyway, differential exposures. It depends where you are in the world. As it happens now, more recently, those two countries have evened up. I think from the last papers I've seen, the difference is not as great.
I bet Finland's become more industrialised, has it?
Yeah.
That's probably what it is.
Yeah, absolutely. Well, certain sperm quality matches across the two countries now.
And you know, another question in terms of the UK and Europe wide, there's a decline in fertility. Are there any occupations that you feel like as if are at higher risk of exposure, environmental exposures?
These are great questions. I've primed you for these.
It's really good.
Well done, Jonathan. That's great. Extra host here.
Well, occupations. So we mentioned occupations in your country, in Uganda, and pesticides. Let me have a think about that. For chemical exposures, I'm going to have a good think about that. It will depend on the environment in which you work. Maybe if you're in a plastic manufacturing industry, for example, I don't know, I don't have that data. Then there could be a risk. But going back to cause and effect, it's difficult because it's not just what we're exposed to in the environment; it's our lifestyles as well. And a lifestyle might be excessive heat, for example. It might be excessive caffeine intake. It might be heightened levels of stress. And there are many, many other factors as well. So the challenge is teasing apart these various influences on fertility. So you could take a population of individuals that work in a specific industry and you think, well, actually, because of the chemicals around in this industry, they might have an effect, but many of those individuals may be stressed or they may have other...
There's lots of variables, isn't there, to actually measure?
It's really, really difficult. There are situations there... If you look at the literature, there are times when there's been a spillage of a chemical, a spillage into the environment. There was one in Italy, Seveso, I can't remember the year now, and there's a number of them. And if you follow up those individuals that had a much higher toxic exposures, then you can show a linkage. There was I'm on a roll now. There was a recent documentary based in a town not far from where I'd live, a place called Corby, and it was about the removal of the remnants of an industry in that area that wasn't done appropriately. Toxic Town, I think it was called. You may have seen it on the BBC. And there were a number of abnormalities in the offspring as a result of inappropriate exposure. have a look at the episode. It was very, very well done. So there's one of a number of examples of how toxic exposures can be linked. So there's more causality there. But when you look at normal occupations, it's really, really hard to show cause and effect, unless it's blatantly obvious, unless you're in a poorer income country in fields spraying pesticides and you're exposed to it day in, day out. That's an obvious one where you can show more cause and effect.
There was a case of that, wasn't there, in the States? Wasn't there, of farm workers that were using pesticides, and that they made a big legal case about their fertility? I'm sure there was.
Really?
Yeah, about that.
Interesting. I had a chat with Melanie Brown a year or maybe 2 years ago about kind of like exposure to pesticides within obviously foods, and she gave me a really good tip, and it's probably good for this podcast really, about the clean 15, the dirty dozen. I don't know if you've heard of it, but it's about fruits and vegetables that we eat in our diet, and the clean 15 are the ones that grow. If they're non-organic, they what's the right kind of phrase here? They don't absorb as much of the pesticides as something that is, like, for example, strawberry is one of the dirty dozen. It's as it grows, and if it's sprayed with pesticides, it absorbs a lot of that chemical compounds. Whereas something like an avocado, the fruit inside the avocado is much more protected away from pesticides. So what advice you gave me around that time is that if you can't afford to eat organic everything, is look at the list of the dirty dozen and the clean 15 and concentrate your budget of your diet buying anything that's in the dirty dozen. Try and get organic, because then you're reducing your risk of the pesticides, because those are the ones that absorb the pesticides quicker. And then the clean 15, the ones that don't necessarily soak up that kind of pesticides or the chemicals, then they're safer to buy as non-organic, if that makes sense. Just straight away, as soon as I left it, I went on Google and had a little look at the list, and it was really fascinating because within children and general health, things like blueberries, strawberries, raspberries, we're promoted that these are really good healthy foods, but actually if you're not buying them organic, you are increasing your risk of these exposures. And coming back to that kind of topic I mentioned earlier about removing Teflon pans and etc. from my house, I actually made that dietary change myself, and I don't know if it's made a change on me, but if I'm actually reducing that kind of chemical exposure, such as pesticides, in my diet, then hopefully that's going to help my long-term health and my child, etc. But it's slight tangent from what we're talking about here, but it is all part of this whole picture, isn't it, of kind of being healthier?
Well, I think my question off of that would be: are governments and industry aware of this? Are they seeing this data? Are they interested in it, concerned about it? Because our birth rate is one of the lowest in Europe's.
It's recently just dropped, isn't it? Is it 1.42 now?
1.4, something like that.
Yeah.
But then you got the big question over industry. Well, are they going to stop using these chemicals because they're cheap, they're easy, they can wrap their foods in it, etc. We haven't even got onto foods and ultra processed foods. That's actually a whole other podcast that I want to do at some point. But there's a big thing around industrialization and governments and health and all of that. So is this data getting to them? Are people being at that level? Are they being made aware of this stuff?
I'd like to say that we're moving in that direction. I think we can still do more. There was that recent call for evidence, Ian, that you circulated, which was a document that went to a government panel looking at all evidence for declining fertility and what we can do about it. Are we doing enough? So that was a tremendous thing. So I wrote my bit for that, and I think Testim contributed significantly. Those are the type of things we need to see more of. I was involved in a similar one a few years ago, where I put in all the work we'd be doing on the dog, and that went to another panel, very similar actually. So that's twice that's happened. It's all about raising awareness at government level, and that will always be a bit of a challenge. There's indications from some people in government that they're beginning to listen. I think we do see a little bit more of it now. I may be jumping around a bit here, but just thinking it through, we're all interested for either scientific reasons or personal reasons on reproduction, on fertility, and its impacts. And poor fertility, of course, is linked to other health problems in later life. Poor sperm quality is linked to all sorts of potential issues. And again, it's a risk balance here. I think if that message was to come through a little bit more, a little stronger to government, that might help with doing something about it. What can we do about it? Well, we could have access to funding, for example, competitive funding, where we can really tackle fertility issues. There are sources of funds out there for sure, but if you compare the funds for reproduction fertility per se to other very serious issues, cancer generally, for example, I'm not suggesting anything changes. But there's more of a tendency to sit up and think, well, cancer's a big problem in all its guises. But these contaminants are linked to testicular cancer. And so if we can understand how those contaminants program the developing testis to become cancerous in these younger men, is that not an area that deserves more attention and more focus? So you attack the triggering points of these later health problems, and I'd just like to see more awareness of that at a government and industry level.
It's that old saying of prevention's better than cure, though. There, isn't it? That's exactly what it is,
Absolutely.
isn't it? The cost to the NHS of cancers is astronomical, and if we can find a way to prevent it, and this is one area, then surely that's got to be only a good thing. Nobody wants to be diagnosed with cancer, right? And if we can,
it's crazy. I think you kind of see the funding and the effort that goes into trying to stop heart disease and cancer and diabetes and all these other things. And like Mounjaro, the new wonder weight loss drug, it's great. Let's start peddling that. It's hang on a minute. Like, actually, if we educated our young people properly, if we did all this screening and educated men about their fertility and what they could be doing, and all of this other stuff, actually, we'd solve a whole load of these problems that people are having in their 40s, 50s, and 60s. It's just, it's all a bit arse about face, isn't it? Really. But bringing this back to patients, because we've covered some really scary and big stuff here, and people are going to be listening to this thinking, God, I'm doomed.
If you're still with us, thank you.
Yeah. This is a monster episode. But for people like Jonathan and Toby, when he was in the trenches of treatment as well, it's like, well, what does this mean? Because a lot of this was out of my control. This may have happened in utero. There's stuff in my environment that I can't control. So what can I do? As a bloke who's struggling with this fertility and worried that this could be me, this could be from this, what can I do?
To me?
Anyone. I'll chuck it to the table.
Well, I think I'll kick off if you don't mind. But I think the changes that there are only things you can control, right? There's me as a racing driver, I only can control the controllables of me. Whatever another driver does around me is that's their bag. I can't change that. So
that's your excuse, and you're sticking to it.
But I'm always looking at, certainly through my fertility journey, and just putting it practically in the fertility space that we're in today, is that I made those changes that I knew would have a positive effect on my diet and lifestyle. So I tried to reduce the exposure. We talk about get your mobile phone out of your pocket as much as you can. Don't have hot baths, all those kind of things. They're things you can control. The scary stuff that we've been talking about today, that stuff that's in our environment, is very scary, and it sounds like we can't really get rid of completely get away with it because the planet's polluted. But I guess my 5 cents worth in this is do what you can do to change that yourself if there's ways, and that the clean 15 dirty dozen thing is one way of doing that, because you're reducing that exposure. And coming back to motorsport, we're always looking at 1% gains, and add those up over time, and it accumulates into a bigger percentage. And if you can create small changes that help, then it's only got to be a better thing, right?
I completely agree with that. That's a really nice way of looking at it. That tiny gain from your contribution added to all the other tiny gains from lots of people can be very impactful.
Yeah,
Sure.
it's the compound effect, isn't it?
Yeah, absolutely. So some people say, well, what difference can I make? Well, actually, you can make a huge difference if you do something, if you reduce the use of plastics, if you have heightened awareness. You know, don't buy the veg that's wrapped in cling film or whatever it is, whatever step you want to take. Try not to buy the plastic bottles of water. Then that will have an effect. And
I do think, I don't know what you think, Jonathan, but I don't know, like for men, I don't know, do they think a lot of this is a load of rubbish? Like, you know, because they hear it and, you know, the vast majority of our followers are women. It's the women that go on the forums and listen to the podcasts and blogs and whatever, and then they tend to communicate this stuff to their men. I'm not saying that's always the case, but that's definitely a narrative we've heard a lot. So, you know, when the woman says, look, we need to change our plastic bottles, we need to get rid of the plastic Tupperware tubs, is that guy really thinking, yeah, is that really a thing? You know, what do you think, Jonathan? Kind of.
Yeah, absolutely. I think, you know, I was telling Richard off camera, talking about when I do my talks, and a lot of the guys, when I'm doing it, you know, I start off by, you know, giving some stats about fertility, say, you know, 1 in 7 couples, etc., and then everyone's like, oh, okay, anyway, but then they always like start to giggle, and you know, it's like the little school kids are like, oh my god, what is this? And then I dive into everything that I've kind of gone through, and then they're like, oh wow, okay, wow, it does affect men, you know. So it's kind of like that narrative like, of unknowing, not knowing anything, and not being educated as such on the topic of fertility. So they think, yeah, who cares? Like, it doesn't affect us. Like. But then it's a lot of women that come up to me at the end and like, oh, thank you so much for talking about your journey. It really helps me, so I know that I haven't got the issue. My partner's got the issue, but then it's always kind of like, how do I address it with them? You know, so, you know, having to change these narratives is kind of difficult because men will always be like, well, who cares?
Yeah.
That's not me.
But having that understanding is really important that it can affect us, because, you know, the start of my fertility journey, my wife, was that I had my semen analysis that had sperm, then motile, etc., and there was a few things that was just suboptimal, but fundamentally it was there. And so when I saw my GP at the time, it was very much that, don't worry about anything, you're okay, just like kind of crack on. So when Katie then was sort of doing her internet research and looking at supplements and diet, lifestyle, and all the things that I could do to improve it, I was a bit like, oh, I'm all right, I don't need to worry about that. It happened that I was the issue some 5 years later, and it was like meeting Ian and the crew around the testing gang that I actually realised that I was the problem. But had I been more aware of these things through education, then I perhaps would have made those changes much sooner and been more receptive to the idea. This topic we've been talking about today is very much that, you know, like you've mentioned, awareness is so key, because if we can educate more and more people around these kind of topics, had they find themselves in a situation like myself and Jonathan have been in, they then might be able to make more effective changes sooner, which could drastically change their outcome. And I always had this understanding through my fertility journey, is that I always find that if through anyone's fertility journey, as long as you've turned over every stone possible and done everything you possibly can at the end of it, whatever the outcome might be, you can kind of then live in some form of peace that you've done everything you can. I think it's really difficult when you've perhaps finished the journey through, you know, your wife's gone through the menopause and it's then kind of a crossing the road, and then find out, oh, there's things I could have done. I think that's heavily frustrating. So we as Testim and anyone within this space has got to do everything we can to educate people, because this is fundamentally life changing for anyone that's involved. So I've gone off topic there, I think, but fundamentally what I'm trying to say is awareness is absolutely key.
Do you know, I totally agree with that. I think, you know, awareness is great, and it also gives you to make an informed decision in your life. Yes. If I had known that I had undescended, well, I knew I had undescended testicles, but if I knew how much of an impact it would have on me, it would have given me chances to make more informed decisions in terms of, you know, in my 20s. Look, I'm a 20-year-old guy. I've had undescended testicles, but I'm out drinking. I'm partying all the time. You know, I'm at university party. I'm going to on holidays drinking, but not knowing that could have a fundamental effect on my body. You know, so if the more awareness allows young men to be like, okay, look, when I go to the gym, I'm not going to take these steroids.
Exactly.
I'm going to drink. I'm going to have organically. I'm going to have broccoli and spinach and put it in a blender and go about my business. You know.
Yeah.
Instead of going to I can go and get creatine and just to do steroids and just to get big. You know.
Yeah, I mean, Jonathan Ramsey mentioned it a while ago to me in a conversation about kind of how the younger generation now are doing everything they can to make themselves look more sexually attractive to women, i.e., you know, hair replacement, therapy. They're going to the gym and they're using like either steroids or what's the word? Anabolics.
Steroids.
Told you I'm the stupid one. You know, they're doing everything they can to make themselves look hunky and, you know, full of hair and like I'm sexy. But actually what they're doing is they're killing their potential future of being a father. And isn't it ironic, right? You're trying to make yourself more sexually attractive to get the woman of your dreams, but you then might not be able to then create a child because you've just done so much damage. And you know, I hope anyone listening to this that can pass the information to the younger generation that potentially is doing that. It's all part of that exposure thing, isn't it? Of all these chemicals that can just create nothing but a bloody problem.
Yeah. Jonathan, I just want to ask for you, kind of, where are you at now in terms of kind of, obviously, because you've had your diagnosis, non-obstructive azoospermia, you've kind of obviously learnt a lot, maybe today and also all the other work that you've been doing over the years. Kind of, where are you at now? Kind of, I guess, mentally, emotionally, but also, okay, well, what's next for you in terms of your fertility? Have you kind of explored that much?
Well, to be fair, mentally and emotionally, I'm great. I think this is the best I've ever been.
Oh, that's nice to hear.
I feel great. I think because I've kind of, accepted certain things about my fertility, and I'm in a place where I'm happy. Okay, right. I know what I am, and I don't allow it to define me.
Great.
And in terms of fertility, my fertility, obviously, when I find somebody new, I'll be able to kind of go through that process of doing IVF. When time permits. But obviously, that's a challenge as well for dating. When to be.
I remember you saying before to me.
When to be, organic with the person. Be like, look, I've got this is a problem, but look, there are solutions.
First date, second date, third date. When do you announce that you're infertile? It's kind of
it's a thing, right?
But then because then I don't want to lead somebody on and be like, after the third date and if someone told them they really like you, like, oh, by the way, I'm infertile, but do you want kids?
But subconsciously that's on your mind, right? And,
absolutely, of course.
And it's always good to be frank and honest with people, but equally you want a relationship like that. So
of course.
It's an extra factor.
I think you said the word accept. You accept where you are. I think that's always such a big thing with anything, whether it's fertility, cancer, or whatever it is, any illness. That acceptance. What can you remember that point? When did that happen for you? When did you say, okay, this doesn't define me. I can still live a fulfilling and happy life.
The day I woke up from my microteasy.
Okay.
Is the day I accepted it.
Really? Yeah.
Yeah, it's because I'm like, okay, right. The surgeons come. Dr. Sangstar, she came along and she woke me up and she said, look, Jonathan, we've managed to find some sperm. We're gonna, the embryology team are gonna call you to go through the further details of you, but we've got some sperm. And that moment I accepted, I was like, right, great. She said that it won't come out naturally for you, no matter what you may want to do. It won't happen, but, you've got sperm, so you can go and do IVF. And then, so I was like, okay, great.
Wow. But it comes back to that knowledge thing, doesn't it?
Yeah.
Like I said earlier about, don't leave any stone unturned. You've done that, haven't you? You've done all of the steps now and you've got all of that knowledge so
Absolutely.
that you're now prepared. I think that the unknown is the scary part for any guy, isn't it? It's like you've been given some news, way back when, and then you're like, what do I do with that? Like, what does this mean? But as you've sort of gone through your journey, you've learned more, about these kind of things and obviously your own diagnosis. It just gives you that empowerment, doesn't it, to then make informed choices.
Yeah. And also talking about it as well.
Yeah.
And being around people like yourselves, it allows me to kind of grow a bit more as well and to accept a lot of stuff more rather than because I could have done the microteasing and just left it completely and been like, okay, right, that's that. And just been
Yeah, and credit to you as well. You know, it being sort of open, it's a brave thing to come out with a story publicly anyway. I think, and I think credit to you to do that. And I think you probably get a lot back from the support you give to other men as well. I'm sure that helps you a lot, because you meet individuals that have kind of gone through the journey. And I think sometimes in this space it can feel very like lonely and isolating, that I'm the only person in this world that's dealing with this. But actually, when you like share that kind of problem and you get that similarities and common ground with people, it's like kind of like a little brotherhood that happens, isn't it? Of people. Yeah. And if you're having a bit of a down day or something, you can just ring out that person and go, oh, by the way, I'm having a bit of a bad day today. And and people get it, right? Outside of fertility, it's hard. I think it's very hard for people to understand what it's like to go through a fertility journey, because how often do you hear, we only tried 1 month and I only looked at her and she's pregnant. How often do you hear those kind of comments that are damaging towards our mental health, because we've gone through the mill? And it's great that there's a community being built, and massive credit to you for being part of that.
Yeah, and same to you.
I think this has been a fascinating episode. We could probably go for another couple of hours, but for the sanity of our listeners and ourselves, maybe we should kind of wrap up.
Been awesome, it's been awesome.
Have we covered enough, Richard? Have we given you enough questions? Have you got any kind of closing comments? Any bit of science that we've missed?
Well,
it's another hour.
No, I'll just make a few closing comments. I think I can always bring in another story, another perspective. I
love hearing them.
But I've described these environmental contaminants, those that are there anyway, those that we purposely expose ourselves to, this changing environment, its impact on fertility. So I'm going to go back to the awareness that Toby was just emphasising there, and yourself, Jonathan. I think it's just so important. I think you're doing a fantastic job, Jonathan, raising awareness in your work community. I think those talks you give sound absolutely brilliant. You're really getting through to people. So I second what you say there, Toby, on that. Let's keep going. Let's keep talking about it. Let's keep raising awareness at every possible level. And I think I'll stop there, Ian, before I go into another story.
We might have to get you in for a third time.
I think there's a third. We still haven't heard about the whales, have we?
No, the whales and the
Inuits.
Inuits.
Yes, of course. Yeah.
I want to hear about the whales.
Oh, go on, quickly, the whales.
Oh, my goodness.
We can't not.
All right.
Okay, so this is a slight detour, Jonathan. So these pollutants are everywhere in the environment. So they affect all the species. And there's a process called bioaccumulation if you look across the food chain. So when we turn our attention to the marine environment, to the seas, if you have contaminants that are taken on board by the smaller organisms, and they're eaten by the bigger organisms, and then by the little fish and the bigger fish, and you go up and up the food chain. If you happen to be the top predator at the top of this food chain, then what you eat has bioaccumulated all the way up through that food chain. And when you look at the killer whale population, these magnificent creatures
Beautiful
that
creatures.
are absolutely amazing, very clever as well. Of course, they feed on the fish, and they feed on the seals, and depending where they are. The other thing about these chemicals that bioaccumulate is that they sit in fat tissue. They love to sit in fat. That's where they're most comfortable. So along comes the killer whale and eats the very blubbery, fatty seal, and takes on board all the chemicals that have accumulated in that seal. So it's like a rush, a contaminant rush, if you like. And then the killer whale itself will then have these chemicals within its own body. And of course, the mothers will suckle the young, and then one of the ways by which chemicals are released by fat is when fat is broken down, and that happens during lactation. So the mum says, okay, right, I need to produce milk. I'll break down some fat in that process because of a change in her metabolism. Those chemicals are released, and the first milk taken on contains this cocktail of chemicals, and all of a sudden you have a calf that's just been dosed, if you like, with its mother's legacy of chemical exposure. And so that's bad news for the calf. So this is the general scenario if you're at the top of the food chain here. And there's good friends and colleagues of mine who've been working on these type of species, killer whales and dolphins and seals. And particularly amongst the killer whales, there's evidence that they are overloaded with an industrial chemical called a PCB, polychlorinated biphenyl. So this is a whole family of chemicals produced in industry, used for coolants and surfactants, that sort of thing. And they're very, very long-lived. They bioaccumulate up the food chain. And the birth rate in many of the pods of killer whales around the world has dropped. And that's a major concern. It's been a concern for a few years now. So the question is, what can we do about it? Well, there's not very much we can do about it. We just hope that birth rate doesn't drop below a critical limit. So there was one study published where they tried to model the way that this reproduction in killer whales would go, and the outcome wasn't looking too promising. So let's hope that modelling wasn't completely accurate. We maintain this species. So that's the story on the killer whales, and it's a problem amongst so many different species on the planet.
Fascinating.
Yeah.
Wow. It's fascinating.
There we go. So are we going to end on that?
Let's end on that. On the killer whale.
Do we need a more update?
Yeah. I think we need to end on that, like that point that you both made, and for you as well. It's control the controllables, isn't it? We can't control what the big industries are doing and what they're pumping into the world and into our food chain and all this and that.
Yeah.
But we can make our choices at home.
We can.
In terms of, okay, I'm not going to put my food. Well, like we've got so many bloody glass jars in the cupboard because that's where we now store our food. Like when you've got leftovers, we've got stainless steel water bottles. Just try and do what you can, isn't it? Because otherwise, you can drive yourself mad. Yeah. So I do think we need to wrap it up because otherwise our cameras are going to melt and we're not going to have any data left to store. But this has been brilliant. Yeah. Jonathan, Richard, thank you so much for coming in and giving up so much of your time and for all the work that you do in the research field and in the patient advocacy world. It's just amazing. If you haven't checked out the previous podcasts with Jonathan and Richard, do so. They're all on Spotify. Richard's will be on YouTube because it was a video one. We've also got an article from Richard on this as well. Reach out to Jonathan. Are you on Instagram? And
yeah, I'm on Instagram.
How do people find you?
My username is JK Luwagga.
Yeah,
you can just type it in and you find it there.
We'll pop it in the show notes as well, so we'll link it all in. So click in the show notes.
And if you've got any concerns, any worries, just reach out. Ping us email, and if you want to chat to these guys, we might be able to connect you. But thank you so much for everyone listening in that monster episode. And we wish you well and good luck.
Yeah, stay awesome, everyone. Thank you.
Thank you, guys.
Thank you very much.
Thank you.